Good morning, Spotlight viewers. I'm Dr. Mohan, Obstetrician and Gynaecologist. So now there's a small session on the childbirth education. So as everybody knows that childbirth education plays a very, very important and good role in carrying out the pregnancy very smoothly. So basically what this childbirth education does is it removes a fear in the mother, and it counsels not only the patient, even the spouse and the other family members also. So they help them to come out of that fear that normally they are born with regarding the pregnancy and labor. So here first it starts as early as 12 to 13 weeks of pregnancy. The childbirth education starts. So in the early weeks we just counsel them about the normal anatomy of the pregnancy, and then the normal physiological changes that takes place in the body. And we tell them this is not a disease. You have to consider this as a normal changes that is going through. And to give confidence to the mother. As once 15 to 16 weeks sets in, then the nausea and all the other symptoms settle down and the patient also feels much better. Then we start with the mild exercises and walking. So in exercises mainly in the early trimester, it is for strengthening the pelvic floor and the body. That is to assist in getting the labor very smoothly done. After around third trimester, the exercises slightly start changing from strengthening to stretching exercises and relaxation of the pelvic floor. That is to assist in the normal delivery. Along with these exercises, there are even breathing exercises which starts as early as 12 to 13 weeks. So the breathing exercise also in the first trimester, it is mainly to relax the pelvic floor and also to prevent this dribbling of urine that occurs as the fetus, it puts pressure on the bladder. There will be dribbling of urine. So to get a good control over that symptom also, the exercises are taught to them. After the second trimester, again it starts regarding some stretching exercises, and around third trimester, it is mainly relaxation exercises. So it brings about a reduction in the rates of cesarean section, the childbirth education classes. Perineal tears are reduced. The length of labor also reduces. They are able to face the labor pains more confidently. And the other complications of labor like prolonged, patients don't move out of the bed quickly. So all that will be taught to them, that early ambulation helps them better. And management of the perineal scar or a cesarean scar, those pain and tingling sensation what is present, how to manage them better. And most important is breastfeeding. For that also they give a good counseling where different positions, ergonomic positions of feeding the baby, the proper latching, expressing milk, how to store, till when it can be fed to the baby once it's stored. Any other exercises which is required postnatally. So everybody thinks if it is a cesarean, their postnatal exercises starts late. It's not like that. Very next day they start small exercises in the graded level from the next day itself for cesarean section, and even for a normal delivery they start from the next day if they don't have a perineal episiotomy or a tear. In case there is a tear or an episiotomy, then slightly later period. Once it heals, then the exercises would be started.